We're Team 4, and this is our business research proposal.
I'm Anissa. I'm Jesslyn.
I'm Jesse.
I'm Kim.
I'm Mackenzie.
And I'm Gitanjali. So the following presentation aims to address the issue of ineffective communication in a hospital setting and proposes a study to solve this issue.
The introduction to our problem is consistency is vital when it comes to successful communication, especially in healthcare. In a healthcare setting, there are changes occurring on a regular basis, whether it's changes about policies, staffing, or even implementing a new process. There is a huge gap when it comes to communication in healthcare and what makes communication successful in healthcare and what should be for overall improvement, patient satisfaction, and employee satisfaction. The reviewed literature will explain these changes can occur to improve as a whole.
So this is our problem statement. There's a problem with internal communication across shifts in a hospital. Despite the need for effective and efficient communication between management and staff, there is a lack of information being passed to staff in a timely manner. Information regarding training, policy changes, and general staff meetings is not communicated to staff consistently across the board, resulting in conflicts and confusion about important topics. This problem has negatively impacted hospital employees, but a study investigating efficient communication techniques could resolve this issue. So for our literature review, we analyzed 12 different journal articles that studied the various aspects of communication in healthcare settings. We found that the content of the studies could be organized under two main categories: articles that aim to study the factors that influence communication in healthcare settings, and articles that aim to study the effects of the implementation of a new communication method or strategy. So these first articles aim to understand the factors that influence communication.
The first article I reviewed was Emails from the Boss, Curse or Blessing, Relations Between Communication Channels, Leader Evaluation, and Employees' Attitudes. The focus of this article was finding the communication channel that healthcare employees prefer when talking with coworkers and management. The article also offers insight on if employees are getting the correct and accurate information when communicating. They also focus on relationships between communication channels and job satisfaction. The three communication channels they focused on was face-to-face, email, and telephone communication. The data that they collected was 265 questionnaires that asked qualitative and quantitative questions. They were sent out by mailers and social media networks. 61% of the participants were female, and the mean age was 25.98 years old. The findings of this article was that the participants did prefer face-to-face communication. 26% preferred email, 13% preferred telephone. They also found a positive relationship between face-to-face communication and job satisfaction, but no positive relationship when talking about telephone communication. The qualitative questions that were asked were open-ended, positive, and negatives about each channel. For email, participants liked the convenience and reprocessability, meaning that they were able to go back to the conversation whenever they liked. The negative responses included the lack of clarity that they have when reading an email, and also the impersonal aspect of not having someone in front of them. For telephone, the positive responses included the clarity of a telephone call and the reliability of the details within the conversation. For face-to-face communication, the positive responses were being able to provide clarity within the conversation and being able to give motivation. The negative responses included that a bad mood given in the conversation can change the mindset of the employees working, and unnecessary conversation can often interrupt the workplace flow. The second review was the importance of internal communication in hospital management. The focus of this article is how important communication is within the hospital management. The authors also focused on what bad communication does to an organization, like create stressors. The data that was collected was 316 anonymous questionnaires that were filled out by doctors, non-physicians, and other administrators. These employees worked at a type 2 hospital that provides acute inpatient care in a minimum of the 3 of the 7 basic disciplines. 56% of the staff filled out this survey. The survey did confirm the need and importance for sufficient internal communication. 80% of the employees agree that effective communication has an impact on behavior and performance, although there is no communication strategy currently in place at the hospital. The responses also uncovered that there is a lack of mutual respect between management and employees due to the insufficient communication. After the responses were collected, a quality manager was assigned to improving internal communication. Since the assigning of this manager, the communication has improved, as well as the respect between management and employees.
The next review is healthcare professionals' perceptions of learning communication in the healthcare workplace, an Australian interview study. The purpose of the study was to focus on the communication skills taught in the classroom, with less focus on how those skills are taught in the clinical setting. The study asked 2 questions: how healthcare providers believe they learn communication skills in the workplace, and what differences are present with the cure to care continuum. The cure to care continuum were previously reported in healthcare management and nursing literature to have a continuum that relates to work-related activities and healthcare providers' roles. The methodology that was used was framework analysis, and it was used to involve a thematic framework, specifically in the study using the cure to care continuum. There were 5 steps that were done in this specific analysis: familiarization, identifying the thematic coding framework, indexing, charting, and mapping interpretation. The findings of this review or this study was 3 themes that were totally found: professional discourse, personal identity, and role modeling. This study features these themes that play a role when learning healthcare communication in the workplace. Professional discourse is the language used by professionals to get things done in the clinical setting, such as medical terminology. The cure to care continuum was found with the cure aspect and showed that discourse shows how communication is learned within context. Personal identities were exposed when participants who were carers or family members. The participants had found the care part of the continuum and were most likely to reflect between personal identities and communication. Role modeling was discovered when participants revealed that their communication skills were learned by observing and not by traditional education. Role modeling leans more towards the cure end of the continuum, since observations were probably from role models in the same profession.
The next article we reviewed is called Contributing Factors in Hospital Internal Communication Based on Hospital Managers and Healthcare Personnel's Attitudes, a Qualitative Study. So this study was conducted at Shiraz University of Medical Sciences, and researchers intended to discover the factors impacting internal communications in a hospital setting. 8 managers and 12 staff participated in open-ended interviews where they were asked what influences internal communication between managers and employees. Participants focused on personal factors, technical factors, and structural factors as the most important aspects affecting communication. Also, 65% of participants stated that there were issues in their ability to communicate efficiently. Findings indicated that leadership skills and new technology were the most important aspects of internal communication. Leadership skills encompass the management's ability to motivate employees, resolve conflicts, be a role model, and support employees. Technology encompassed the usage of cell phones, social networks, and administrative automation in effective internal communication. Overall, many of these factors rely on the manager's use of them to facilitate efficient internal communication.
So for the next article, we have intra-organizational communication in healthcare. The purpose of the study was to improve communication in healthcare with the use of information and communication technology, also known as ICT for short. This study was based on other reviews of ICT and its roles within intra-organizational communication in healthcare. The goal was to find the best way to improve communication within the organization while introducing ICT methods into play. The study found that there are multiple approaches to improve ICT use within intra-organizational communication in healthcare. The three main focuses should be on controlling the effect of the social context, developing standard information processing skills, and controlling variations in care practice performance.
I completed my review on an integrative review of organizational factors influencing successful large-scale changes in healthcare. The purpose of the study was to determine organizational factors that negatively and positively influence the success of a large-scale change in healthcare. The method used for the study was a thematic analysis. Researchers gathered articles from 4 databases between 2009 and 2018. Through the use of thematic analysis, they identified enabling or hindering factors to large-scale changes. They found that 7 key factors were found to be the main contributors to the success of a healthcare organization implementing large-scale changes. These factors are infrastructure support, organizational culture, leadership, change management approach, roles and responsibilities, networks, and management and measurement and feedback. For factor 5, roles and responsibilities, they found that leaders failed to clearly and effectively communicate to staff about their role expectations, which led to confusion and decreased quality of care. For factor 6, networks, communication was strong and effective when senior leaderships were responsible for communicating rather than designating tasks to frontline managers.
So these next articles involve the implementation of a new communication method / strategy.
So this article is called "Can SBAR be implemented with high fidelity and does it improve communication between healthcare workers? A systemic review." The purpose of this review was to distinguish if SBAR, which stands for Situation, Background, Assessment, Recommendation, when used correctly, improves communication between healthcare workers. SBAR was considered as an implementation strategy because of its impact on clarifying communication and other quality measures, specifically in healthcare. The data synthesis of this was that 2 independent reviewers abstracted data based on the preferred reporting items for systemic reviews and meta-analysis, specifically regarding intervention details, study outcomes, and features. The reviewers wanted to categorize the impact of SBAR by defining the magnitude of effect for each outcome. Relative improvements less than 20% were considered small. Improvements in the range of 20% to 40% were moderate, and any improvements over 40% were considered large. The findings consisted of 28 studies, 3 randomized controlled trials, 6 controlled before and after studies, and 19 uncontrolled before and after studies that met criteria. They were then split into a classroom setting or a clinical setting. Results showed that there was a high uptake of SBAR and communication improvement in the classroom setting. However, in the clinical setting, it is going to take more effort and use of SBAR to see significant improvement in communication. SBAR was easier to achieve in a classroom setting due to the overall lack of utilizing SBAR in clinical setting. It's not used in the clinical setting as it should be, and it's more forced in a classroom setting. If the utilization of SBAR in the clinical setting was higher, there is a chance of significant improvement of communication in the clinical setting.
So this next article was called "Adapting the Managing by Walking Around Methodology as a Leadership Strategy to Communicate a Hospital-Wide Strategic Plan." So in a study at Metropolitan Hospital, researchers aimed to determine the efficiency of a new communication technique called Management by Walking Around, MBWA. MBWA is characterized by managers setting specific times to walk through their departments, employees creating networks with one another, some information being shared during lunchtime and in the hallways, and managers speaking with individual employees. In a 2-week period, the executive team organized multiple meetings in all departments across various shifts to introduce the new strategic plan being implemented. Attendance was taken at each meeting. About a month after these meetings were held, a satisfaction survey was sent to staff to determine how they felt about this new communication technique and whether they understood the new strategic plan. Findings reveal that 69% of hospital staff attended the meetings, which was a 48% increase compared to attendance at staff meetings in the past. In the post-meeting satisfaction survey, about 65% of staff indicated that they understood the strategic plan. The employees stated it made them feel respected and involved, that the executive team came to them to speak about this plan, indicating that this form of communication was effective. Although this communication technique involved a lot of time and commitment to execute, it proved to be an effective means of communicating for important topics needed to be shared with the entire organization. This method could be executed on a smaller scale throughout individual departments to increase efficient and effective communication between management and employees.
In an article called Improving Communication Among Healthcare Workers, a Controlled Study, the purpose of this study was to test the effective dialogue trainings and to see if it was effective on communication and teamwork among healthcare workers. The method for the study was a randomized controlled study completed amongst 300 healthcare workers throughout 10 hospital units. The study provided unit leaders dialogue training to be implemented within their unit. Workplace communication was measured in 4 ways: social support, trust, openness, and participative safety. Measurements were taken every 3 to 6 months. The findings of this study found that DT did have an effect on participative safety and social support from supervisors. The training was most effective at the 6-month follow-up. The process was mainly successful because it bolstered a common task and information sharing.
The next article we have is titled A Curricular Innovation to Promote Interprofessional Collaboration. The goal was to improve interprofessional teamwork and communication within healthcare practices to improve patient care. The study used a test group of different students who all worked in healthcare but on different levels and had them in a simulation training course reacting to an end-of-life situation. The test group's experiences were recorded using a survey to assess the effectiveness of the study. In the study, they found that the simulations worked effectively and the study group received the exercise well and felt prepared to work in an interprofessional team in the real world.
For improving communication in healthcare, a case study, the authors concentrated on the communication process between healthcare workers in an environment not compatible for technologies to improve the communication techniques that current hospitals use. They decided to use information and communication technologies, or ICT solutions, for healthcare workers to achieve improvements for communication. They analyzed the research for the case based on participatory design that explains scenarios, techniques, and adding the user's input to validate the developed solutions. Collab was the system used as a tool to improve communication, and it resulted in improved communication with findings such as when the employees are working independently, staying informed about other teams is essential. Team strategies and tools to enhance performance and patient safety is one of the most implemented national initiatives to improve quality, safety, and efficiency in healthcare because it provides training materials to merge teamwork into healthcare settings to improve communication. The purpose is to implement handoff as a part of team steps initiatives to improve shift change communication. Since communication styles tend to vary, it is hard to have consistency, and team steps will supply specific strategies to improve communication. For the research, the authors used qualitative methods along with semi-structured interviews with key participants and observed the handoff process during shift change with the approval of the institutional review board. The results showed that there was no difference between high and low performance, but facilitators and barriers did. Staff involvement was a significant facilitator to change management and to generate buy-in by explaining the reasons and importance of handoff. It showed that leadership support aligned with vision of the hospital was associated with the success of handoff implementation and performance. The 8 hospitals that the study chose to, after the study, they chose to change their approach and to the shift change handoff.
The 3 research questions we had was, does the communication channel used in a healthcare facility have any effect on job satisfaction? Does the lack of communication between employees and management at a healthcare facility have an effect on mutual respect? And what communication channel works best for employees in a healthcare organization when policies and important information need to be exchanged?
The research design we propose would be a descriptive research design. In descriptive research designs, the variables are observed without experimental manipulation. In our proposal, we will observe the effects of the current communication strategy in place at the hospital. Then we will implement a different method to communicating information from management to staff. This may include face-to-face communication, emails, flyers posted around the hospital, announcements, and staff meetings to make employees aware of important information regarding hospital trainings, policy changes, and organizational structure changes. This study would involve qualitative and quantitative aspects. Quantitative include attendance rates at staff meetings and employee engagement and new communication methods. Qualitative aspects include surveys, questionnaires asking employees if they understand the information that is being communicated and how they feel about the new communication methods. The results will help us determine the effectiveness and efficiency of these communication methods in the hospital.
In conclusion, we found that effective communication leads to improved quality of care, improved interdepartmental cooperation, and improved employee satisfaction by eliminating confusion and just allowing people to work better with each other. Administration can improve communication through face-to-face meetings or group huddles, weekly leadership meetings among night shift, day shift leaders, executives will allow everyone to be on the same page, so they're giving out the same message across the board. And open door policy would allow staff to just come in and talk to administrators, ask questions without being confused and having to figure stuff out by themselves. And these are our references.